They're the ones who raise the bar. The ones dedicated to providing care in the most demanding of circumstances. The ones that understand the healing benefits of kindness and compassion. They're the people of Sarah Bush Lincoln, and they set the bar high. Sarah Bush Lincoln, trusted, compassionate care right here close to home.
For over 50 years, Horizon Health has been keeping you and your family healthy. And although some things have changed, Horizon Health's commitment to meet the ever-changing needs of our community has remained the same. Horizon Health, 50 years strong.
Carl is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carl, with Health Alliance, is always at the forefront to help you thrive.
Thank you for joining us for this episode of Being Well. I'm your host, Lacey Spence, and today we are talking all things foot health. Our guest today is from Sarah Bush Lincoln. We've got Dr. Kimberly Eickmeier. Welcome.
Thank you.
And so you are a first-time guest of the show, so we like to get to know our doctors a little bit better. So where are you from originally?
I'm originally from Bloomington, Illinois. I was actually born in a small town by the name of Fairbury, and then I went to Illinois State, and then I went to podiatry school up in Chicago, and then did my 3-year residency in Detroit and did a fellowship in Switzerland.
Oh, well, we're glad that you landed back here in Coles County. And so what made you want to go into podiatry?
Well, I'd always known that I wanted to be in medicine. So I was kind of looking around, optometry, dentistry, plastic surgery, reconstruction surgery. And my anatomy teacher said, well, have you ever thought about being a podiatrist? And I was like, a podiatrist, what is that? My grandmother was confused with a pediatrician for a long time, but, I said, I don't know what that is. And he said, well, I have a friend who's a podiatrist, let me call him. So he called me and I went to his office and I hung out a little bit. He was seeing infants to seniors, doing a little bit of surgery, and sometimes patients would walk out of the office feeling better right away or pain-free right away. And so then I lost my job at the hospital and he hired me and I loved it.
Excellent. Well, I tell you what, the feet, they're the foundation of the body, so it's important that we take care of them. So it's good that you're here today. So talking about podiatry, might have kind of covered it already, but what is a podiatrist?
Well, podiatrist is basically you go to a school for 4 years after receiving your college degree, and then you do a 3-year residency. Some also do a fellowship. And what we do is we specialize in treating anything below the knee, basically. When we're our first year residency, we act as if we're internists or pathologists or whatever service you're on, then you're doing exactly whatever that service is you're expected to.
I didn't even realize that you could go, I guess, above the ankle. So that's cool. So what are the most common things that are treated by a podiatrist?
Well, especially this time of year is plantar fasciitis. And I'll tell you, we had a lot of it because of COVID as well. People were home not wearing their shoes and becoming more active. We found actually people had more time to get out and get back into running and working out, exercising. But especially this time of the year, traditionally, the weather becomes nicer, people start walking more, running, and plantar fasciitis is what we know as heel pain, or some people in the old days used to call it heel spurs. But we know nowadays heel spurs don't cause the pain. People can come in with heel spurs and we see them on x-ray, but they don't have heel pain. So plantar fasciitis is basically if the arch is falling, there's material on the bottom of the foot, which is the plantar aspect of the foot, like plantars wart, that actually starts to tear off the bone and bleeds, causes inflammation and pain. So really, to get rid of the heel pain, you need to wear good shoes and good arch supports.
And so that's typically how you would realize that you have plantar fasciitis, is because there's the heel pain? Or what does that feel like?
Usually, typically what we call post-static dyskinesia. Okay, so that's Latin for after I sit down and I stand up, I have a lot of pain. Or when I go to bed at night and I get out of bed in the morning, that's my greatest amount of pain because everything's contracted, tightened up. And then when you get up out of bed, it really pulls and rips. So that's one sign. And swelling, of course, of the heel, or in bad cases, if you have some nerve involvement, swelling, pressure on the nerve can cause tingling sensation, shooting sensation. We also see a lot of athletic injuries, sprains, fractures, warts, diabetics. That was another thing during COVID. We found out that unfortunately there were 10 times more amputations in diabetic patients because of COVID. The patients, and they were worse, the amputations were at a higher level because the patients were reluctant to see their physicians. Like right now, what is the price we're paying for those patients that needed to see their cardiologists during that period of time? What are we going to see in the future for heart? Well, we've already seen it for the foot and diabetics. So, if we see a lot of infections, diabetic infections. Ingrown toenails is another one during the summer, which I'm not sure why. I don't know if it's because the feet are swelling and the shoes get tighter, but we see a lot of them during the summer.
And how do you typically start to get an ingrown toenail? Is it just inactivity, or you didn't quite cut them properly? How does that happen?
Well, sometimes trauma, dropping something on it, that's rare. Sometimes from wearing shoes that are too narrow, too tight. Like my kids were always, when they were young, outgrowing their shoes. I had to keep an eye on that carefully. Or also, like my son, he has the flattest toenails I've ever seen, just like his father. So what I tell him to do, or some people cut them too short and cut down the corners. So this is what you need to do. What I tell my son, let them grow out a little bit longer, but son, please do cut them eventually. Let them grow out a little bit longer and file the edges with like an emery board. Don't go in there with scissors because it's really difficult to get down in there, and you can introduce bacteria and cause an infection.
So if you were looking for a reason to kind of justify that pedicure, maybe let the professionals handle it, because sometimes it's hard to reach, and that maybe is part of the reason why you're cutting in too deep or something like that. Right,
right, and make sure you use clean instruments. Boil your instruments, or at least our tools. Yeah. We call them instruments, but you can buy your own on Amazon, online. A lot of spas, you can buy a set there and they keep it for you, or you can take it home and clean it real good with alcohol or boil them. That really helps prevent some infection.
And so you mentioned having to keep an eye on kids as they're quickly outgrowing shoes. So I see you brought a couple of shoes with you. So what can you tell us about these shoes, about what makes them a good shoe or what makes them a not so great shoe?
Okay, so basically this is a good shoe, and I tell patients it's the 1, 2, 3 test.
Okay.
Okay, so this is cushion for the Achilles tendon. This is called a heel counter. I should not be able to take my thumb and push the heel counter down to the sole. Also, so that's number 1. Number 2 is the twist test. When I twist it, it's pretty stable. I shouldn't be able to twist it like a rag. And number 3 is when I turn it upside down and bend it, it should bend where the toes bend. So this is a nice, fun shoe, my daughter's shoe when she was on the dance team in high school, but it fails all 3 tests. Number 1, fails, push down to the insole. Number 2, twist. I can twist it like a rag. Number 3, where is it bending?
Right
almost in the arch. So this is not a good shoe, but this was her uniform shoe and it looked cute. But so we just, sometimes we do wear shoes that we shouldn't be wearing, but we need to know that. When I tell my patients, listen, I wear shoes that aren't good for me, but it's kind of like when you go out to eat and you go to a buffet. Now, you might go back for seconds for maybe some potatoes or the roast beef, but you need to limit yourself to the dessert table, right? You don't go back. So you need to limit yourself to heels, bad shoes. Save them for when you're not going to be on your feet for long periods of time. so that you don't end up with problems down the road.
So basically, you want your everyday shoe to be a really good, solid shoe that passes those 3 tests if possible. But if you're going to do something fun, sparingly, that's when you can kind of say, I'll opt for the higher heel that's not so great.
Right. And
gotcha.
if you have foot pain, it's best to be in an athletic shoe like this while we're getting everything to heal. But, you know, of course, we're not going to want to wear these all the time for the rest of our career, the rest of our life. They're comfortable, but there are some other good dress shoes out there. Once you're doing better and we can get you into those, we can also, I have to admit I cheat and I know how to modify certain dress shoes. So with certain arch supports, over the counter or prescription made, certain pads to balance the ball of my foot out right so I don't get hammer toes. But there are some good brands of shoes as well that you can look for.
And let's talk about hammer toes. What are hammer toes?
Well, hammer toes are, actually I've got a model right here.
Perfect.
Take a look. This is a normal arched foot,
okay,
and the toes are out straight. This is a high arched foot. This is a low arched foot. So the high arched foot, the toes are bent as compared to the normal arched foot. So they kind of bend up like this, or like a claw on a hammer. Some people call them claw toes. And what the problem with these is that you can start getting pain from shoes rubbing on top here, or over on the side, or the toes on the end. And you can end up getting arthritis, and then they can get so bad that they actually push down on these long bones, the metatarsals, and start to cause pain in the ball of the foot, or calluses, or what can become open wounds for a diabetic patient.
So what is causing that? Is it literally just the arch, or is it like a type of shoe I've been wearing or an activity I'm doing? How do I get the hammer toe?
It's usually from your foot type, or a tight Achilles tendon, which can occur as we age. That can cause your foot to act in such a way that you'll start to grab, the toes will bend like this to kind of want to balance your foot. But also sometimes shoes, if they don't fit you right, they're too narrow or they're too short, are going to push your toes up, and then you're going to eventually end up with a hammer toe.
So how important is it to also, on that same token, make sure that your shoes are wide enough, that they're not too tight and squeezing inward? Yeah,
that's important. You know, what we tell patients to do is, remember the old adage of you need a thumb's width between the big toe and the end of the shoe. It's not the big toe, it's your longest toe. Some people have a long second toe, so you need to stand up. If you don't know, go to a good shoe store where you know that they know what they're doing and they can check to see. There are some good shoe stores that can look at your foot and not even measure your foot and know what size you wear. And the other thing is sometimes you can pinch the side to make sure there's enough room. Too bad, I don't know if you remember this, you may be too young, but there was a shoe store where you could stand on this box, and every time we'd go out to the mall, we'd stand on this box and you can see your bones of your feet through the shoes and see if they fit. So that's how they sold them to you. Too bad we don't have that, but they found out it wasn't really healthy for you, you know.
That's why it's important to talk to your doctor and go to a professional and make sure you get those.
Go to a good shoe store. Don't go somewhere where a high school kid's gonna go run and get another, you know, a size 7.5 when maybe you're no longer a size 7.5.
So what is a tailor bunion?
Oh, okay. A tailor's bunion is metatarsal bones, the long bones. A tailor's bunion is the 5th one. So for some people, that bone can shift out this way, and tailor's bunion, what I was told in school, is tailors used to sit cross-legged on the floor while they were working, and if they were cross-legged, that area of the foot was up against the floor and it would put pressure here. So for instance, I have a young kid I was just seeing in the office who, I've done everything I can for him. He cannot work. He's in so much pain. where he developed a really bad callus and then a big, huge bursa, and he has a bone spur right here on top of a tailor's bunion. So we have to actually remove that, which is unusual. We've tried all kinds of different shoe gear, and we can't get him back to work right now.
So what is a bone spur? Because you were also talking about a heel spur, and I'm not familiar with any of the spurs. Fill me in.
Well, some of them are just an additional area of bone. Some can be round, but people think of them as being pointed, but that's not necessarily. So it's just extra bone where it shouldn't be. You can have bone spurs around joints when you have arthritis. Basically bone that's there that shouldn't be there and may cause some problems.
Does that have to do with if you get a bunion on the other side? Like not near your little toe, but near your big toe?
Right, yes. Bunion is right here with the first metatarsal shifts this way. So, and then when you have that problem, the big toe, as the first metatarsal shifts this way, the first metatarsal shifts and then the toe stays because of ligaments. So the cartilage doesn't ride right. The joint doesn't go up and down like it should. So it starts to wear down the cartilage, and that causes pain and bone spurs, arthritis. So a lot of this stuff is inherited. Patients will say, oh, my grandmother had bad bunions, or my mother had bad bunions. But we know kind of nowadays what to look for, and we have so much better shoes that just because your mom or your grandma or grandpa, my grandpa had bad bunions, had bad bunions doesn't mean you're going to necessarily have a bad one.
Is there kind of like a point of no return with bunions where you have to like do a surgery or something like that, or what kind of remediation can you do?
Yeah, that's another tricky. What you want to do is you want to have surgery early enough where you don't lose the cartilage. If you wait for too long, then you would need to have an implant, and there's not a whole lot of good implants. I've tried them all and I don't like them. Or you'd have to have a fusion. And for a young person, I hate to do that, but that's the way to get rid of pain, and then hope down the road in 5 years, medicine's advancing so quickly that there would be a good implant. But basically, I tell the patient, don't wait for too long, but you'll tell me when it's time to do your bunion. When you can't do the things you need to do or want to do, you need to clean the house, you want to go for walks, you want to play with your kids outside, that's when you should consider it.
So other than just foot health kind of inside the foot, what about if you have cracked heels?
Yeah, that's a real big problem. What we find is that patients that wear backless shoes, a lot of them get this. It's, I can look at your foot and say, okay, you wear Crocs or you wear Birkenstocks. Especially Birkenstocks will suck the oil out of your feet. And patients with diabetes, they don't produce the oil like they used to. So those can become so bad that they crack open and bleed and become painful.
Ouch. So is it just swapping out the shoes, or do they need to moisturize? What does care look like?
Well, while we're trying to get rid of those cracked heels, I ask you not to wear a backless shoe, and diabetics should not wear a backless shoe anyway. We need to protect their feet, and we don't like them to wear Birkenstocks because they need that extra oil. So what I ask my patients to do is, quite simply, you can soak your feet in 1 cup of white vinegar to 1 gallon of warm water, that ratio, for about 20 minutes, and then take a pumice stone or a wash rag and kind of rub on it, and then put lotion on, and then put your socks on. And there are also a wide variety of heel balms. There are socks with gel heels with aloe vera in it, grapeseed oil in them. There's something called Baby Feet, which is an exfoliating product that you put your foot in this plastic bag, and then your skin will start peeling off like 3 or 4 days later.
That sounds intimidating.
But you should not ever use that if you have bad circulation or diabetes. So I mentioned that, but you should make sure you get that okayed with a doctor that can check your feet before you do it. For fissures also, fissures are the cracks and the calluses. We can use honey. Honey is antibacterial. It never goes bad, it never spoils, right? There's medical honey. You can even get a degree in medical honey now out of England. We have it on the floors at the hospital for wound care patients. That works. And then some people will use liquid bandage. That can burn. Or super glue. Yeah, you have to be careful because some of those cracks, you can have some fungus and bacteria in it, then you're kind of sealing it in there. And something that we really need to look for is, we need to look for what else could be causing those dry heals. Vitamin deficiencies, like C. C is a wound healing vitamin. Psoriasis, eczema, the shoe gear. A lot of patients that have peripheral neuropathy or numbness of their feet, they'll come in with calluses and not feel that they're cracked open either. So that can be a problem.
So as we are taping this in the summer, I know that this can kind of be the season for stinky feet. What can you do about foot odor?
Yeah. Okay. So stinky feet. What causes? Well, first of all, let's think. What would cause that? What causes stinky feet? That would be feet sweating, right? And bacteria or fungus. So what better place for bacteria and fungus to live than the inside of this? So that's why when, especially teenage boys, they produce a lot of sweat, a lot of liquid from their feet. We have 250,000 sweat-producing pores in each foot. So our feet can develop a half a pint to a pint of liquid per day. So what we need to do is, a shoe cannot air out in 24 hours. You should not wear the same pair of shoes 2 days in a row. I recommend my patients to spray their feet with underarm antiperspirant. Of course, wash your feet real good and dry between the toes. Again, it's going to smell at first. 1 cup of white vinegar to 1 gallon of warm water. Soak your feet for 20 minutes. At first they smell, but then the odor goes away. There's also items you can find on the internet where you stick them in your shoes. I recommend this to a lot of construction people this time of the year. Guys and women out working outside in the heat, or any time of the year. It's a UV shoe sanitizer, and some of them you can buy them with a air dryer, or you can use them in ski boots, or and the UV shoe sanitizer kills the bacteria and some of the fungus inside the shoe. Basically, that's it. Look at the bacteria, the fungus, the environment that it likes. Stop sweating. There's also prescription antiperspirants or Botox, believe it or not.
Oh, you're getting your feet Botoxed up. Okay.
Yeah, they used to have to do, if your hands were sweaty, you used to have surgery between your ribs. And then they found out they can inject the hands, areas of the hands, with Botox. It reduces sweating. I knew of someone that her hands sweated so bad, I mean, she just couldn't even handle work with paper. And so the feet can be so bad, we know where to inject Botox for that as well.
Interesting. So if I am looking to, I guess, seek your advice, do I need to have a referral from like a primary care doctor, or can people go directly to podiatrists?
No, you can come directly. You can call the office directly, unless your insurance company states that you need a referral. How do you know that? The best thing to do is take a look at your card. On the back, there's a customer service card, and call that number. Or you can call your primary care doctor and talk to his receptionist or his nurse or her nurse, and they will know if you need a referral, and they can just send one over to us.
In our last minute, is there anything else that you'd like to add that I didn't ask about?
Oh, I think we covered a lot.
Say we sure did, from heel to toe. I think we're good.
Yeah.
Well, thank you so much for coming on our show. We appreciate it.
Thank you.
And thank you for joining us for this episode of Being Well, and we hope that this helped out with your foot health needs.
Carl is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carl, with Health Alliance, is always at the forefront to help you thrive.
For over 50 years, Horizon Health has been keeping you and your family healthy. And although some things have changed, Horizon Health's commitment to meet the ever-changing needs of our community has remained the same. Horizon Health, 50 years strong.
They're the ones who raise the bar. The ones dedicated to providing care in the most demanding of circumstances. The ones that understand the healing benefits of kindness and compassion. They're the people of Sarah Bush Lincoln, and they set the bar high. Sarah Bush Lincoln, trusted, compassionate care right here close to home.